Okay, so for the second patient mock telehealth encounter, the first prompt, what were the advantages and disadvantages of using telemedicine during your encounter? So I think for me, the main advantage, or for an athletic trainer, would be the main advantage is that the AT isn't always able to travel with the team. And so they might be away, and FaceTime may not be as applicable um, for an athlete, or maybe they don't have an iPhone or a Samsung, or they have differing things like that. So that's one of the major advantages for an AT, at least, is that you're able to communicate in different places. So that's helpful. And during my encounter, I used my brother as a subject, and he lives in a different state. And so yes, FaceTime works, but I think it's nice to have the telemedicine platform rather than a FaceTime, because it makes it more professional. You can better monitor yourself and the patient. Some disadvantages of the telemedicine for this encounter were spotty service or recording. So I could tell there was a little delay in what I was saying to what when he was hearing and responding. So that's something you don't normally experience with FaceTime or other, even like a Zoom or something like that. So that's kind of difficult and hard to deal with per se, because you want to make sure they're understanding you correctly. So if you're talking and then asking for feedback, and it might get delayed and lost, or things might not get heard correctly, so that can be a disadvantage for that. But overall, it's pretty. Another disadvantage would be um, learning how to use the software again, and especially for the documentation process for the class, it's kind of hard to have to screen record on a separate website and then figure that whole thing out. And then for saving the recording doesn't save in the best quality, and I don't have anything to do with that. So that's another thing that is a disadvantage per se. So if the second prompt, if I were to do this again, what would you have changed about your preparation or patient care? So for preparation, I would have wrote down some questions on my iPad and had a better structure to my meetings. So making sure I ask permission to video, and making sure I get the correct patient name, and like, are they comfortable with this, and do they have any concerns before we start. Just having more structured topics to speak about rather than just kind of going with the flow. So that's what I would do to kind of help me out for preparation. Because obviously it's a mock thing, so I can kind of predict what's going to happen, but in a real situation, you're not going to always know. So you want to be able to jot down a quick note if there's something that concerns you, or yeah, you can save the recording, but then that also goes into the whole factor of, are they comfortable recording or not? Are you able to figure out the software's screen recording, or do you have to use a different screen recording software for that? So instead of relying on the video footage of the thing, having a set note structure that I can follow and add to and to take away from and alter, that could help me be more organized, more professional, more structured overall. Um, I think that would be super beneficial, and even for the patient as well, because it seems more on topic. in line with questions and I'm not going bouncing around from place to place. I would also have um, kind of an arsenal, if you will, of different back stretches, knee stretches, leg stretches, upper body stretches, that kind of thing, and have more resources on my computer that I can share my screen with so they can see what I'm instructing them to do better than me just trying to lay on the ground and hopefully position my computer in the right way so that they can see. I think that would be super helpful also, but obviously it's a fake deal, but just kind of to have those resources on my computer so then I can screen record, email the resources to the athlete or what have you, kind of just to have more guidelines and more references for them too, so that they're being better instructed on the care that's being given. So that can be super helpful. And then that kind of goes into what I would change about the patient care also. So just being more prepared, being more ready to diagnose and treat a patient, and having better resources to help them out with that. Um, Especially when it's something physical, like like with ATs rather than mental. So for me, I use telehealth with my doctor for medications, and so it's just kind of a chit chat back and forth, less of a demonstration. This is what you're doing, or this is where it's hurting on the body. So maybe having more resources that the patient can fill out prior as well. I think that would help. Kind of just like an overall summary statement. Where's your pain? Circle on the body, how long has it been happening? They can kind of send that to me so I can look at that prior to the video or the meeting, and then everybody's on the same page. So that's the most important thing, is that everybody's on the same page. Everybody understands what's going on. You're treating the patient correctly. You're getting all the correct information. And that can kind of help the patient too, because if they're just answering the questions as they're being given over the meeting, they might forget things that are important to them or are important things that they failed to mention. And then they're like, oh, shoot, I wish I told them this. And then it's kind of a backtrack relay, trying to reach the physician or AT and being like, hey, I also had this question or this issue and I'm not sure what to do about that, or what it kind of leads to. So that can, having the pre survey almost can help them to get all their thoughts in one place. So then the AT or physician is then getting all the information that's necessary and relevant and helpful to the case. So I think those would be my main things. So yeah, just being more prepped on my end of things, and having a note structure laid out on my iPad or a notebook, with the questions I'm going to ask and the answers, obviously, and then trying to dive deeper into things, maybe if it's necessary, and having kind of prompts that can lead the athlete into a better explanation of how they're feeling. And then the resources on my end too, for stretches and kind of pictures and video guides to better help them understand what they're doing and grasp what they're supposed to be doing. And then kind of a pre-assessment for the patient, so that that can help with the patient care, making sure that everything is getting treated and there's no concerns on the table for the treatment path, and just no symptom or sign is being missed with the pre-assessment thing. So I'm able to have that copy of what they filled out too, to kind of have alongside with the telehealth. So yeah.